Welcome. I'm Dr. Ken Piper, and you're about to view a video in my series, The Wonder of Our Bodies. And today we're going to explore the amazing dynamics of the cardiovascular system. That blood does go round and round and round. On part one, we're going to focus on the artery system. And for a long time, anatomists and physiologists and physicians knew there was this center thing in the chest called the heart. They knew there were pipes going out of the heart, but they had no idea how the blood got back to the heart. They didn't really comprehend that there's a circuit through the lungs and a circuit through the body. And we're going to, in part one, talk about arteries that carry the blood away from the heart. And in part two, we'll pick up the little connecting vessels, what's been discovered to be these tiny capillaries that join the tiny arteries with the tiny veins. Blood goes round and round, and the capillaries are where the action takes place and we nourish our body cells. So part one is about arteries. We want to talk a little bit about the blood so that you have a sense of it. If we look at blood, the body's got about 10 pints. 60% of the blood is water, and the water contains nutrients like fatty acids, amino acids, and simple sugars like glucose. The water part also contains hormones of different sorts, all kinds of messenger chemicals that are going around the body, bringing all the miracles together. There are antibodies in the blood, minerals in the blood, all kinds of other vitamins and more. The cell part, however, of the blood is limited, well, not limited, but they're basically red blood cells, white blood cells, and little clotting cells called platelets. Red blood cells are critical. They have protein with an iron core that allows them to hold on to oxygen and then release the oxygen. Iron deficiency produces an anemia because you got to have that little bit of iron to make the protein work. This slide shows that low blood oxygen stimulates liver and kidney. They'll produce a little hormone you see in blue called erythropoietin. Hormones go in the bloodstream. Bone marrow gets the message. Red cells get produced. And this is another of the amazing feedbacks that our body uses to our life advantage. The red blood cells are small. These are about 1/25,000th of an inch, those little red ones. You see their interesting shape. Each blood cell has about a 60-day lifespan, and any one given blood cell will travel around the cardiovascular system round and round about 70,000 times before it kind of gets old and then is taken out of circulation. Here's a red blood cell and a white blood cell on the right, and a little platelet in between. Now, those white blood cells come in many types. They're scouts and messengers. They're attackers. Some make chemical factories. Some are cleanup cells that kind of eat and engulf any invaders. Some white cells repair. Some white cells rebuild. And we have about 5 to 10,000 per every drop of blood. Those platelets you see in the middle are little cells that plug up damaged blood vessels. Notice the shape. If the inner blood vessel wall is damaged, platelets are activated. They form plugs. They join together. They make chemical messengers that bring on repair cells. Platelets know their job. They circulate around just waiting for a chance to stop bleeding through a damaged blood vessel. So when you prick yourself with a pin and the bleeding stops in a couple minutes, it's the platelets that did their job. Aspirin interferes with platelet blocking, with platelet aggregation, and by a blocking effect. Here's a little diagram of platelets that have been activated. They link together and form a mesh or net that provides a framework for the body to build a little clot that closes things off. Aspirin interferes with this linkage, Some arthritis drugs in the non-steroidal family do the same. Plavix is another drug often used in therapy that also blocks platelet agglutination, and we need about 200,000 per drop. The left heart pump is our most important part of this cardiovascular system. Blood would not go round and round unless the main pump could make it happen. It's a marvelous structure. This is a CT scan of the overall heart. And if we just do a drawing detail, you can see on the right, the left ventricle. Ventricle is a name for main pumping chamber. Look how thick it is. It has special muscle cells. They're all kind of spiraled together. On the left side is the thinner-walled right ventricle. And the difference in thickness has to do with the difference in pressures that they must generate. So the left heart pumps about 70 times a minute. That's about 95,000 times a day. That chamber pumps about 5 teaspoons per beat. It's about 2.5 ounces, which is about 2.5 gallons a minute, which is 4,000 gallons a day. And just take a breath and think about that much fluid pumped out of that single chamber around the arteries, through the veins, around the arteries, and through the veins. The blood pressure in your aorta is 120/80. The 120 is the pumping pressure. The 80 is the resting pressure. A heart has to generate whatever pressure it takes to open the outflow valve and get blood to flow in the big pipe. And the big pipe I'm talking about is called the aorta. It's a large blood vessel. You see it here in red. It starts at the heart where the outflow valve is located. It makes this turn on high in the chest and then travels down through the diaphragm, down into the abdomen, and then divides. So that long aorta coming all the way down is an amazing structure. You can see it distributes blood everywhere, up to the brain, to the arms, all the way through the body. And it has special structure. It has 3 layers, and it's kind of like a premium garden hose, one of those multi-layered ones. But the aorta has an inner lining of living cells. It has then a nice layer of what we call smooth muscle, a different muscle than in your arms or legs. The smooth muscle links together and has a squeezing action. It relaxes and squeezes, relaxes and squeezes. The third layer is an outer thick membrane coating that gives the aorta great strength. So with every heartbeat, the pressure drives into the aorta stretches a little bit and then comes back to its normal state, kind of a throbbing with every beat. The aortic outflow valve is at the base of this curve, and the aortic valve in more detail is a critical valve in the body. When the left ventricle pumps, that valve opens, and the heart wants to rest, all the pressure in the aorta will slam back against that valve. You can see on the upper right what a valve looks like closed, and then you can see on the lower right what happens when it's opening. Those leaflets are thin. They have a little kind of a cartilage edge on them, but the leaflets are quite thin, and here's a great picture on the left. This is what the valve looks like closed when the heart is resting. You can see all the pressure has to be carried in those 3 pockets as they seal together. And when the heart pumps, those leaflets flip open rapidly. Unfortunately, if those leaflets get damaged and thicken and calcified, they'll start to really get in trouble, and this happens. This is a valve that's severely damaged. It is narrowed. Those leaflets do not open. The little flaps don't work. And this patient's about to undergo valve replacement surgery. Branch arteries, I told you the aorta sends things just everywhere to every system. About 20% of the blood from every heartbeat goes up to the brain. The brain is very greedy for blood. The tissues in the brain are really dependent on oxygen and nutrients. The brain cells do not store glucose, so they have to have a constant supply of energy. And it's a very high metabolic area with 12 billion brain cells all functioning at the same time. This just shows the branches to various places. The complexity of branching is unbelievable. I'll show you a few examples of that. Critical are heart arteries. It's a well-formed system. The first arteries off the aorta go right back to the heart. And they're visualized here in red. They're surface arteries. And you can imagine why they're surface, because the heart is squeezing. You want the fuel lines on the outside. And then the fuel lines distribute the blood through spiral penetrating arteries, nicely shown on this CT angiogram. If we do dye studies and we put dye into the coronary system, this is a bit of what you can see, this amazing complexity of arteries penetrating. There's a big left coronary artery that takes care of the front, side, and back of the heart, and the right coronary takes care of the right side and the bottom. And these arteries have the potential to join one another. They're called collateralizing. Heart attacks occur when there's a blockage in a main artery. On the left, you see someone in the middle of an acute heart attack. Heart attack means sudden occlusion of a major artery, all kinds of symptoms, but usually a real pressure feeling in your chest, maybe your arms, maybe your back. Cold sweats, nausea, short of breath. This patient, thankfully, was brought to the emergency room in the first 30 minutes of those symptoms. And in the circle, you can see the totally blocked artery. And this is the main artery going down the front of the heart. A catheter was put in that artery. A balloon was put in, opened up. The blockage was broken down and blocked. And on the right, you can see that 5 minutes later, there's terrific flow going down that artery. Heart will not be damaged permanently. And this is a life-saving approach, which is now, thankfully, the emphasis on acute heart disease. We want patients in the cath lab within, 45 minutes. We're approaching brain artery blockage in much the same way. Brain attacks are the equivalent of heart attacks. You block a brain artery, you cut off circulation to a critical part of the brain, you're going to get permanent damage. So the approach now, and you can see the coronary arteries there, the carotid arteries in red, the big ones are the carotids going up to the brain. The ones in the bones there are the vertebrals. They go up in the neck structure. This is easier to see. This is a CT angiogram showing the big branches leaving the aorta, going right up to the brain. And a more detailed view shows more of these branches going way up into the base of the brain. The carotid arteries and vertebrals join together in kind of a traffic circle to equalize distribution of blood. If we do a detailed study, again, you see some of this complexity that as the arteries get smaller and smaller, the inner networking gets more and more dramatic. I can see small blood vessels by looking in your eyes. And if these little arteries and veins are healthy in your eyeball, in the back of the retina, then the little arteries and veins in your brain and kidneys and heart are probably in the same state. So when we see high blood pressure damage, hemorrhages, leaking blood vessels, closed off blood vessels, just looking in the back of your retina, we learn a whole lot about what's happening in other similar small vessels in your body. This is truly a window into the cardiovascular system. Heart attack, cath lab. Brain attack, get to the emergency room. And the approach we're taking now is to talk about working fast. So if someone at the dinner table seems to be kind of off, look at their face. Is the face drooping? Is an eyelid drooping? Have them raise their arm. Just say, raise your arms. See if they can raise both arms equally. Have them say something. What's your name? And if their speech is slurred or mumbled, call. Get help. EMSA, emergency room. On the left is someone who has blocked a major artery. You notice no flow going to the back of the brain. 5 minutes later, the artery's been opened. Look at that whole back of the brain and just imagine the size of the stroke that was prevented by this approach. Aneurysms, these are little metal coils. There's an aneurysm on the left. Many of these in the past were approached with surgery to put a sober clip at the base. Now we slide a catheter up there, and in many cases are able to put that little ball of yarn, that little twisted mass of special metal into kind of a little nest that closes off. There's arteries all over the body, arms, legs, other places. I'm going to show you just a few. Here's arteries going to the arm. Two of them. One's called the radial, one's called the ulnar. The radial is the one that the doctors and nurses feel when you put your fingers up at the base of your thumb, and you can feel that yourself. Fascinating to notice that the two arteries coming down your arm form a loop in the palm of your hand. So again, a backup system. Blood can come into your hand from one of two arteries, and then you see off that loop, you see the little branches going out to each finger. Abdominal arteries, talk about briefly. There's a single branch to the spleen, a branch to each kidney, a big branch that goes to the small intestine, a branch that goes to the large intestine. The liver and stomach get branches. This again is a super complex system necessary to keep these critical organs alive. And this is just a picture of the most dominant intestinal organs, the liver, stomach, pancreas. Notice the pancreas is behind the stomach and right on top of the aorta. The kidney arteries are critical. Here's an example of a kidney artery that's partly blocked. If you squeeze off a kidney artery a little bit, this is usually from atherosclerotic or diabetic problems, but if the kidney doesn't get enough flow, it will start producing a chemical to raise the blood pressure throughout the body. A kidney that's in trouble from not enough flow will get very aggressive in raising the pressure, even though that raised pressure could have a bad effect on the pump, the brain arteries, other arteries in the body. If that aorta is under too much pressure, an aneurysm can occur. Here's a nice normal aorta. You see the two branches going off to the kidney. You see that nice aorta going down below to the bottom of the slide. That's where aneurysms develop. And CT angiogram has been very helpful. We can see all of these branches so beautifully. The arteries to the intestines are set up in wonderful complexity. Look how the arteries flow and jump from one section to the other. This is why we can take out a piece of colon for cancer or diverticulitis. We can take out a section of intestine without impairing the blood supply. So we've taken you part of the way around the cardiovascular system. This is part one. We've taken the blood through the main pump, around the main aorta, down to the branches. We're going to go ahead in part two and discuss what happens next, and discuss what happens to those small arteries, how do they connect with the small veins. So we'll talk about capillaries, veins, lymphatics, and aspects of that miracle of our cardiovascular system. So thank you.